it's a little surprising, actually, when you look at what's really going on in genetics. You find that, by and large, patients, consumers, all of us, are much more knowledgeable about genetics and risk of disease than our own clinicians. There was a study done both in the Netherlands and the United States where they looked at primary care providers to see what percentage of them had ordered a test for genetic-based cancer in the prior year. And of those primary care physicians, 30 to 40% had ordered the test. And when they then examined what was the highest predictive event of the physicians ordering the test, it was not how well they had been educated, it was not how old they were, it was not whether they had obtained a family history of cancer from the patient, it was the patients asking for the test based on having typically Googled their disease or family history and seeing that there was a genetic test available. And so, in fact, patients want to get that information often. The healthcare system often doesn't know what to tell them. And so I think our bigger concern was not so much that the patients would be concerned, and they might be, and I think they have to go through a very detailed consent process because of this, but our bigger concern is, are we as a healthcare system equipped to actually respond to the patients when we have a finding to say, this is what you shall do. In fact, the most expensive part of the Gene Partnership Project will in fact be the genetic counselors. Because yes, we do anticipate there'll be a large number of questions. So yes, I do think there will be some patient concerns, but by and large, I think the concerns really are more on the side of the healthcare system than they are on the side of the patients. Patients often know when they want to have genetic tests. They're often highly motivated to participate in genetic studies, especially if they have a family member who is stricken by one of those variants. And so I think we have to be very careful at not undervaluing or underestimating the eagerness of patients to actually move medicine forward. It's we as patients who want disease to be cured, and when it comes to us personally, I think we get much more determined to move things forward than a well-meaning administrator.